this was a terrible episode. Not that the
Agreed.
episode, like, it was a good episode. A terrible topic.
The topic is so
Yeah,
sinister.
yeah. Uh,
Anything that involves, I think, health, and then especially, I don't know why it just hits a soft spot for me, but mental health and taking abusing people in such a vulnerable state.
yeah.
Um, what a terrible, terrible situation. So we're going to talk a little bit about that and how it ties into new types of medical applications,
Yeah.
smartphone applications. Um,
And then
yeah,
I want to know if you can surprise me. I have a challenge
that's
to
right.
the audience. Can you surprise me? I don't think so. So we did a story similar to this around the time that, well, we've actually done a couple stories. So around the time that Roe versus Wade was overturned, we did a story about how tracking apps were selling location data for women visiting abortion clinics that could potentially be used as evidence against them by law enforcement. And there was some evidence that that was actually happening, if I recall correctly. We, prior to that, I think, did a story about the period tracking apps selling information. And this is just, I mean, not just another one of those stories, but another one of those stories. And this research talks about how basically telehealth and therapy apps collecting information about your mental health and selling it. And there's
So
no law
dangerous.
against it. So it's totally legal for them to do this, probably
So,
even
so
in their terms of
dangerous.
service.
And if we go back in time, a more ignorant Mike once told me, I might be paraphrasing the quote a little bit here, but I don't care. They can have it all. But as me and Peter and Mike grew closer week after week, we cracked open that nut, and Mike admitted that there is a line.
Yeah,
This is one of those
this
lines.
is pretty bad.
This is so, so bad. And now
I don't
people
think
might
I'd say
say
that about this one.
the argument might be here. No, I don't. I didn't think you would. You are enlightened. You are a new person.
Well, Peter and I have been having other conversations that might lead you to believe otherwise, but
Okay. But regarding PII or PHI, and crazy that this isn't classified as such, but um,
yeah.
some people might be like, so what if they know that I had depression? Or so what if they know that I get anxiety in large groups of people? Right? Or anything that has to do with
Right.
mental health. So
But
what?
yeah.
What bad can happen?
Oh,
What negative things can
yeah.
come from this? And today, maybe nothing.
Well, I mean,
Maybe nothing.
we'll bring up a couple
Maybe.
examples of what's being sold, but it's
But
it's
in
pretty
the
bad.
future, this could be used against you in a limitless amount of ways.
Yeah, I mean, right
Anyway,
now, best case, they're just using it to target you for advertising.
right. Well, most likely I can't see it could there could also be, yeah, target you for advertising for medicine is what I could see, like big pharma's siphoning up this data. But
Mhm.
then also I could see an argument for research done on, this is arbitrary by the way, research done on, people who are clinically depressed make purchases from these types of storefronts or whatever, more
Yeah.
than not, right? Like they impulse buy this type of thing more. Just as an example, I don't know if that's true. Probably isn't.
Sure, it's
But
true.
then they get to purchase that data and target those types of people to make money, which is so sinister.
Yeah, and
But
I
yeah,
think
what are
that
what are some of the oh yeah, go ahead.
I think the issue is that you are not sharing information with a healthcare worker who would not then be allowed to disclose that information. You're
Right.
voluntarily sharing information with an application
Yeah.
whose terms of service likely allow them to collect and sell and reuse that information. So we started with this article, Washington Post article, and it links to this research that was done. And so here are some of the key findings from the research. 26 of the 37 contact data brokers responded to inquiries about mental health data, and 11 firms were ultimately willing and able to sell requested mental health data. One broker charged $275 for 5,000 records, but other firms had subscriptions or licensing access available for $7,500 to or $100,000 a year. And this is the bad one. One of the data brokers advertised highly sensitive mental health data to the author, including names and post addresses, personally identifying information, exactly who you are and where you live, of individuals with depression, bipolar disorder, anxiety issues, panic disorder, cancer, PTSD, OCD, and personality disorder, as well as individuals who have had strokes, and data on those people's races and ethnicities. Yikes.
So some people might be more informed than others and say, whoa, 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 this sounds like PHI.
Personal health
This is a HIPAA, personal health information. This is a HIPAA violation. HIPAA only covers the data that is stored by health insurance and health providers.
Yep.
So if I am in these teledocs slash like pseudo, I don't even know what to call them. They're kind of falling in a gray area, and they might not be, I don't know, a lawyer would have to speak on this, but they might not be bound by the same federal regulations that your traditional hospitals, traditional health providers, and traditional health insurance providers are.
Well, as I
Super
understand the
scary
problem, they could be real doctors, but you're not their patient. You're a customer of the application.
Right, exactly.
You're not giving your information to the doctor. You're giving it to the app.
You're giving
provider.
your information to the app. Then the doctor just reads what you provided to the application, and there's maybe a loophole for this. And now this is going beyond just mental health disorders into actual just straight up health problems like cancer and strokes. Wow, terrifying.
Yeah. So it says right in the article exactly what we've been saying. The Health Insurance Portability and Accountability Act, HIPAA, restricts how hospitals, doctors' offices, and other covered health entities share Americans' health data, but the law does not protect the same information when it's sent anywhere else, allowing app makers and other companies to legally share or sell the data however they'd like.
Yeah.
And this is so go ahead, John.
Oh, I was just going to say kind of like an FYI for all of you who are watching is this is why it's so important not to share personal health issues with anyone outside of your health network. A health network is what Mike just read off, which is your health insurance provider, your doctor at a hospital, or like at a clinic. You just don't. If, a boss can't ask you, but if a boss or a coworker does ask you, you don't need to. If they say, well, you have to provide a doctor's note, not a problem. Have the doctor's note. But once you willingly give up certain information, you're not protected by HIPAA anymore. This is why it's so important. So we saw this actually when a bunch of people were uploading their COVID cards, their COVID vaccination cards. It's really damaging when you share health information, because in the future that could be used against you in the event that you, let's say, sue a company for leaking your health data. They're like, well, you were frivolous with your data anyway. How can you be so sure that it was from us, or whatever the scenario is? So be very careful with your private health information and health issues. But yeah, that's all I wanted to say.
Yeah, I think I just share my standard disclaimer, which is assume that everything is going to be shared. Like you have an expectation of privacy with your doctor, with your healthcare provider, with service providers that are covered by HIPAA. An app provider out of the Google Play Store or the Apple App Store, you have no expectation of privacy.
None.
Anything on a website, do not share your information unless it's a known closed portal. But at the same time, some of these apps are so useful. Like And they're pop. I don't know what specific apps are covered here, but like you'll hear some of the therapy apps promoted on different podcasts. Fill out your information, get on demand. It's cheap, it's easy, whatever. There's risk to that. So does the risk outweigh the benefit? I mean, you got to make that choice for yourself, I guess, but know that data can and likely is being sold. Geez, every case. You can't trust anyone. Fuck everyone.
No.
God damn it.
And the problem is that a lot of people don't have the resources to go to a therapist and pay $300 a session. And instead they are able to go to an app and pay $10 a session and talk to a psychiatrist or talk to a therapist, get the same level of treatment. But the trade-off is where this friction occurs. What is the trade-off? Is it worth for potentially the world to know that you have X or Y issues? Personally, no, but I'm able to provide, but others might not be. And that's such a tough decision to have to make. And like you said,
It is.
it's a decision you're going to have to make.
Yeah, I want to know from people watching, who watching now has been watching for a while and is jaded enough to not even be surprised by this,
Right?
or who's surprised by this. And I think I'm looking for some brainstorming. So we've heard about the period tracker apps, the location data being sold, mental health data sold. What have we not been creative enough to see the risk of? Apps
Right.
that we're using, information that we're giving away. Geez, we talk about like Google tracking. Either what's the worst violation in your mind, or what's the one that would shock even me? Bring it on. Let's hear it.
That's a good one. Yeah, I look
Oh
forward to
boy.
reading these.
Yeah.